There is a connection between muscle mass, sarcopenia, and sexual function.
Men with more muscle mass have better erections. Men with less muscle mass have horrible erections, have low libido, have lower testosterone. It's all about overall health. Again, think to the paradigm about how the body is willing to give away its erectile function if it has to sacrifice something, but it's going to keep brain function. And as we get sicker and unwell, the penis is the first to go. So don't get unwell. Stay strong. So when men train, when men lose weight, when men gain muscle, erections get better. Aerobic activity is as powerful as PD5 inhibitors, the drugs like Cialis that we talked about earlier, in helping with erections. A modest 10% decrease in body weight is as powerful as pills in helping with erections. Not only all the other benefits of keeping you on the right side of the grass. So again, if you take good care of your body will take good care of you. Anything you do for penis health is good for cardiac health. So it is not surprising at all that there's a direct correlation between muscle mass, strength, grip strength, and erectile quality.
You just got the attention of every male listener on the planet.
Yeah, well, good.
Or at least
good, because
we're listening to the show, because who doesn't want better erectile function and better penis health?
Yeah. And you know, just to jump in, we use the penis as a fulcrum for behavior change. It is very difficult for the average man to change your behavior if you tell them, listen, your blood pressure is 8 points too high. But if you tell them, listen, if you lose a little bit of weight, if you start exercising, just minimal gains, 150 minutes a week of exercise, 30 minutes 5 times a day, you'll see tremendous improvement. And so we can use this as a fulcrum to get guys to be healthier. In Canada, the cigarette packages have like this flaccid cigarette on the side. And it basically says smoking is bad for your erections. So we should lean into this fact and get people to be healthier because, yes, sexual function is very sensitive to overall health, and we should use it as a way to get people to be healthier.
Is there a dose? You said 150 minutes of moderate to vigorous activity. Is there a known specific dose that is good for penis health or vascular health primarily? I mean, I know that we're talking about vascular health in general. But again, as a urologist, I thought that we would focus on your organ of longevity, the urologist's organ of longevity versus my definition.
Right.
Do we know, is there a dose?
Study by Zhang et al., I think from last year, 2024, they looked at the NHANES data, which is like a community cohort database from like the early 2000s, and basically have found that 150 minutes of exercise per week decreased the rate of erectile dysfunction by 20%. 300 minutes by essentially 40%, something very close to that. So, you know, intensity and duration, as it gets higher, you get improvements. There is eventually you plateau. It's like if you do 1,000 minutes, you're not going to get perfect erections, but even a modest amount of exercise really moves the needle. And then if you really are exercising 300 minutes a week, that's an hour, 5 days a week, which is a great goal. You'll see a 40% improvement in erections.
I'm going to just lay out a handful of other statistics and numbers because I think they're so powerful. Studies showing men who maintain muscle mass strength are 66% less likely to report multiple sexual issues. Older men, this was fascinating but not surprising, sarcopenia was linked to 2.7 times greater risk of moderate to severe ED.
Both those studies are excellent in that, a lot of them are self-reported studies and where the people are quantifying their own strength. The one study about the muscle mass, that's from like a bunch of Scandinavian patients, and the people who reported that they still were strong had awesome erections. The people who said, yeah, I feel a little bit weaker than when I was 10 years ago, they had lousy erections and lousy libido too.
What is the role of testosterone and erectile function?
And testosterone is essential to a certain point, right? So if you have normal testosterone and you give more testosterone, there typically isn't of added benefit, right? So a mistake you'll make is like assuming if somebody comes in with a normal, you check their T, it's normal, but they have problems with erections. By giving the testosterone, that typically doesn't fix the problem. Remember, the main etiology of erectile dysfunction is probably vascular blood flow problem. So you got to fix the blood flow. If testosterone is very low, though, then penis ain't going to work.
How would you define very low?
Well, if you want to use the scientific definition, a repeated measurement of testosterone less than 300 or free testosterone less than 5. So if it's low, if you give testosterone back to those men, they typically will see a better better erections, especially when they're trying to use pills. Cialis, Viagra, they rely on testosterone for nitric oxide synthetase, or the chemicals that are required for erections. If your T is low and you give T back, the pills will work better. Again, I just can't stress enough, though, if you take good care of yourself, your T will stay normal. There's data where, people who look healthy in their 70s and 80s, their testosterone is way higher than people who look unwell, and
My
their
dad
T is really low. Yeah.
Let's just throw Nate Dogg under the bus again. We ran his labs, and I'm looking at this testosterone of over 700.
No, that's amazing. And I would argue that the best single blood test for overall health in men is testosterone. In women, maybe, but maybe there's a ratio we need to look at. And then along those same lines, the best overall marker for overall health in men is erectile function. Why? Because you have to have excellent vascular integrity, excellent overall health, and the penis requires normal mental health. If you're anxious, if you're depressed, the penis ain't going to work. So you can be in great physical shape, but if you're unwell from a psychiatric perspective, whether it's depression or whatever it is, anxiety because you're having stress at work, again, the penis ain't going to function well. So all systems have to be on full go for the erections to be awesome. So that's a really reassuring thing. If you're a 70-year-old and you're getting great erections, you're probably pretty healthy.
Is there a point of no return? For example, when we image the brain and we see microvascular disease of the brain is arguably a large, very active organ. There is a lot of it. The brain can make up for itself, meaning it's not just dependent typically in this one area, but the penis is smaller. If there is vascular damage to the penis, is there an ability to recover?
To a limited extent, like many other things. But sometimes you get age-related, vascular disease. Maybe it's untreated hypertension for a long time, or you have significant atherosclerotic narrowing or plaque, or maybe you smoke for a long time. Sometimes the damage is so extensive that no matter how much you exercise, no matter how many pills you take, it ain't going to work, right? Yes, there is a point of no return. Very avoidable if you never get there in the first place. But that's where surgery comes in. For men who may have had a reason that their penis has failed them, or maybe had a period in their life where they were very unhealthy, we can restore normal sexual function with surgery. Oftentimes we can restore it with lifestyle change, but not always. And so, take good care of yourself. But then even if it fails, there's no reason to give up hope. We can fix it.
You mentioned exercise, penile vascular health. This is the first time I have probably ever said those words together.
Yep.
I'll just say them again, penile vascular health. Exercise increases blood flow.
Absolutely.
Are there things like I saw Austin Powers and he has the penis pump. It would also make sense if we exercise our muscle that perhaps something like that would also work.
The guys may take advantage of this statement, but the penis is a use it or lose it organ. Okay. So when the penis goes in the garage for an extended amount of time, meaning no erections, like no sex, no physiological erections that normally occur in the middle of the night. Now, why would that happen? You just had a prostate surgery, and you stun the nerves, you have significant diabetes. You've basically just gotten to the point where the erections aren't happening very often. We know that men who don't get erections commonly get penile shortening, right? So you lose length of the penis.
Everybody wants to know how rapid and how much.
Yeah, so on average, if you've got a consistent lack of erections for 3 months, you lose 1 to 2 centimeters of length, which is a ½ inch to an inch in length. And every millimeter guys fight for, right? So
that's a lot.
It's significant. Yeah, it's significant. Actually, earlier in my career, as I was a urologist at the VA and we were doing prostatectomy surgeons, the patients would say after the prostate surgery, they'd say, "Doc, I think my penis is shorter." I'm like, no, you're just a little bit fatter. It's hidden more, and then they kept saying it. And that was like one of the first studies I ever did. And we actually measured, and it's true. Guys lost penile length. The good news is that if you exercise the penis with a vacuum erection device, you can regain that length back. So it's not about like physically shortening the penis. It's about having scar tissue in the penis. And if you have a uniform scar with erection, the penis looks shorter. If you have a non-uniform scar, you get this curvature, right? And that's Peyronie's disease. Peyronie's disease is loss of elasticity on one side or one part of the penis. And like a balloon, if you put a piece of tape on a balloon, you inflate it, the balloon's going to curve where that piece of tape is. That's what Crohn's disease is. And again, that's something that's very common in men, about 10% of men above age 50.